So my name is Mark Jones. I'm Chief Information Officer for Dorset Healthcare, and I work within information management and technology. My experience with QI started in 2010 when I was asked if I'd be interested in program managing a quality improvement and transformation program for the acute trust I was working at in the Northwest. And we put Lean and Six Sigma into all corporate and clinical areas. And it really opened my eyes to the power and the empowerment that quality improvement can give. So in terms of the benefits, I see that there's a profession and a specialism as regards QI, but actually it's a bit like the adage of puppies are not just for Christmas. It's that quality improvements for everyone and for always, and the real embodiment of continual improvement should be for all of us, really. And I know from a personal point of view, as well as members of staff that have supported over the years since my first immersion in quality improvement, the ability to have new lenses, to look at waste in a different way, to look at the waste involved in transport and inventory and motion and waiting and overproduction and overprocessing and defects applies to itself in every single area of a hospital and across healthcare and out in non-healthcare industry as well. And I just can't advocate for it enough. It changed my career. I left digital to go and do quality improvement. I didn't think I would come back. But I had an opportunities to bring digital and quality improvement together, and that's what I see in terms of my role now and my role into the future. And I also want every member within IM&T to have quality improvement skill set, because we collectively can do so much in improving our processes and the way that we serve our customers by using quality improvement and being able to optimize processes and then find the right technology to fit around that. So it's sort of similar to my last answer, really, in terms of the role of leadership. I feel has got a few elements it should consider. First is about getting an awareness and understanding of quality improvement. As I say, I had a fantastic opportunity to learn about QI and gain that skill set, and it has changed my career. And it's allowed me to look at digital in a different way by being able to apply those lenses. So my role in terms of that is to make sure that I am continually improving myself and ensuring that I still retain that skill set as I move into the future. My role in terms of leadership as well, and any leader, I feel, should be about creating an environment where our staff can feel that they can be empowered with those skills as well, but not just the training and the education involved in that. It would also be about creating a safe space to be able to learn and an environment to use those techniques and apply those techniques. And if you can apply it within your own area, there are then more opportunities into the future of working with others in other areas to look at processes that span across departments. So I feel we're doing a disservice if we don't provide that shelter and shield for people to be able to apply quality improvement. And it won't always be right. Sometimes will not apply the right techniques, or there may be a better way of doing things than what we've applied, but we should be creating a space where we can fail fast and learn from it and improve. On the PDSA cycle, study's so important as regards that, and that's about studying the things that go well as the things that don't go well to be able to improve into the future, because it's not continuous, it's not a straight line. You'll move up a couple of steps and then maybe come back a little step, but it's continual in terms of the direction of travel. That's a really interesting question in terms of, I've worked in quite a few organizations, and in almost every organization, quality improvement has been separate to digital and other sort of improvement areas. that areas that have the ability to improve. And I feel one of the big myths is that it's felt that it's a skill set that sits within a specific function, when actually, back to an answer I gave earlier, it's for everyone. The specialism is absolutely right, and if you have it in your organization, it gives such tremendous value because it is focused within those skill sets, and as well as being able to help others improve. But actually, my thought is that everybody should have that. Everybody should have those lenses to see where there is waste or there's variation that could be reduced. And I suppose that's the biggest myth in terms of thinking it's for someone else to be able to do. I suppose the other thing that sparks for me is about when we look at programs of work, particularly in hard times, we tend to focus on costs and reduction of costs. And actually, it feels to me that it's looking at things at the wrong end in terms of high quality processes, high quality care costs less. It's been proven over and over. And I've always been interested in the stories around how quality improvement formed. And I really love the story about Taiichi Ohno, who is considered the father of the Toyota production system, which is part of the start of the journey into QI as we have today. And he was asked, what is the secret of the Toyota production system? And he said, there is no secret. You have a process and it takes this long. But if you remove the waste and reduce the variation, the process will take that long. If it's that long, it'll be higher quality and it'll cost less because you don't have the costs of that variation, you don't have the cost of that waste. And when I read that just clicked for me and thought, actually, it is really applicable because all we're looking to do is to look for high quality by being able to optimize our processes. And the costs come out of the system if you do that, but you focus on that quality element. So I suppose those are the things that spark when being asked about demystifying what quality improvement is. I think I'm a big fan in terms of the adage of high quality care costs less. And for a set of digital services or information management and technology, IM&T as we're known, sometimes it can be felt that services outside of those clinical elements shouldn't be necessarily looking into QI because QI is done in a different corporate manner. And actually, it's very complementary. And when we can bring the teams of quality improvement and digital together to be able to work on things, we get so much more because we can look at that removal of waste, we can look at a reduction of variation, and we can look at no longer squeezing people into IT shapes, but into optimized processes so we can create greater value either in clinical care or the support around clinical care as regards that. So for colleagues that are in clinical areas, I think quality improvement has been proven over and over to be fundamental to better outcomes for our patients and the people who use our services. But I suppose my side from coming from a non-clinical area is that for my colleagues in corporate areas, non-clinical areas, quality improvement, if you don't have that deeper awareness, then I would recommend you to have that because, as I say, it's allowed me to look at the way we run our services, the way we change our services very differently. And I wouldn't have had that if I hadn't come across quality improvement.